Hello again, it's Jake Rahman here, and we're at IMSH 2026. And we've been walking around the halls, and we've come across these guys from Glasgow with Medascend, and we've had Ahmed and Hannah. And guys, I wondered if you could introduce yourselves and tell us what you do.
Yeah, no, of course. So I'm Ahmed, I'm the founder of Medascend.
I'm Hannah, I'm also one of the founders.
So a little bit about Medascend. It's an interactive virtual AI platform where you communicate with virtual AI patients in two-way conversations. It's mainly there for healthcare learners to practice their communication skills, their clinical reasoning skills, and boost their confidence before they go into speaking with real patients.
Fantastic, brilliant. So could you give us a little overview about a platform that you have?
Yeah, no, of course. So what happens is learners will get pre-consultation context, so they'll basically get information about what's going on with the patient beforehand. It could be referral letters, and then after that they then go into an immersive scenario where they basically speak in the two-way conversation with the patients. So the patients are extremely realistic. They speak real, they sound like real patients. They're completely customizable as well, so you can customize the way that they speak, like the way that they sound, how they look, the facial pathologies, the backgrounds around them. So yeah, we're all about realism at Medascend, so that's the main goal.
Hannah, can you show me a scenario? Can we start one up?
Of course.
Yeah.
So we can choose, we have quite a lot of different scenarios here. Let's choose our anemia review. So this patient here has come for her anemia checkup. She was diagnosed around 6 months ago, and the aim of the consultation here is just to take a history, see how things are going with her medication, and see how she's managing with it. So after you finish reading the context and the task, you move on to start the session. And as we mentioned earlier, all of our patients are customizable. So you'll see with this patient, when we speak to her, first of all, she's got some facial pathology, she's got some acne on her face to sort of increase that realism. She's a little bit scruffy, and when we talk to her, you'll realise that her mood is slightly lower. So she responds in a lower tone compared to a lot of our other patients that might be angry or that might be happy. So I'll just begin the consultation. Hi there, my name's Hannah, I'm one of the medical students. What brings you in today?
Hi, I've just been feeling so tired all the time. It's really getting me down.
Okay, and when was it you were last seen about your anemia?
I think it occurred 6 months ago. The
Okay,
doctor gave me these iron tablets then.
okay. And how are you feeling in general? Like, is it impacting your day-to-day life?
I'm just so worn out most of the time. It's
Okay,
really impacting my life. I don't feel like I can enjoy spending time with my friends or doing my hobbies like I used to,
okay,
because I'm just constantly tired.
okay.
It's really
I'm sorry
starting to
to hear
upset
that.
me.
I'm sorry to hear that. What do you hope we can do for you today?
I just want to know if there's a way I can feel better. I don't know if these tablets are supposed to take this long to work, but they don't seem to be helping much at all. I feel
Okay,
like I'm wondering if I can get iron injections instead.
okay. How are you managing with the tablets? Are you managing to take them every day?
I try my best, but they make me feel really sick. I've
Okay,
even thrown up a few times. It's
okay,
hard to take them when they make me feel like that.
okay. And are you able to take them every day, or is it every second day? Can you tell me how often?
I try to take them every day, but sometimes I miss a dose because I feel so nauseous.
Okay.
It's hard to keep up with them when they make me feel so poorly.
So as you can see, that's a sort of snippet of how our consultation works. You can see she has a very distinct personality, so it's not the same for every patient. We really want to simulate the wide range of patients that healthcare professionals will see, but we want to create a safe environment so they can practice talking to patients that are sad, practice talking to patients that are angry, so when they go into practice, you're sort of familiar with that experience.
Amazing. I mean, so from my point of view, what I can see with the personality of the patient definitely comes out. You get some metrics, a metric score for
Yes,
the student as well
that's
after
correct.
this. That can be fed back to the student, of
Yep.
course, yeah. How many patients have you got?
So we have over 100 different patients currently, but with institutions they can create their own patient, how they look like, how they sound, so we leave it open access for them to do.
Brilliant. So thanks for that introduction. Great
you
to
so
see you
much.
suffering from Glasgow. Ahmed, Hannah, one more question for you.
Yep.
I know this is going to be difficult for you guys,
Mhm.
but in 2026, within medical simulation, what are you most excited about?
Oh. Have you got an
Apart
answer?
from AI.
Apart from AI. Right, okay.
Have you
I
got
mean,
one? I'll probably have a different.
you know, that's a difficult question. But I think, apart from AI is obviously the buzzword topic, it's what everyone's talking about these days. But I think an important aspect of simulation is interprofessional education. Like between medicine, nursing, allied health, pharmacy, there's a lot of synergies in what we do.
Yeah.
But then there isn't that much opportunities to practice those skills out with of those environments before you're actually tasked with talking to a nurse or like talking to a pharmacist or calling in the physios, something like that. So I think a big aspect would be interprofessional education at scale and enabling different healthcare students to speak and interact with those interprofessions, not just patients. Because at the end of the day, I think a lot of the communication as well within healthcare, within hospitals and things like that is between clinicians as well as patients.
And so that's a brilliant answer, actually. And what we find in medical simulation is companies tend to focus on one area. They forget about other people that help with that patient pathway as well. So they're developing something that's going to be, useful for all allied healthcare, whether you're in nursing, whether you're working at a GP surgery or a doctor or whatever, when you're doing assessment. I think that's brilliant. Thanks very much, guys.
Thank you.
We really appreciate you taking the time with us today.
No, we appreciate you for coming.
Cheers.
Thank you.
Thank you so much.
Thanks.
Thank you.
Thank you.
Take care.